Good afternoon, everyone. Joined by Director of Public Health, Dr. Mark Veitch, Kath Morgan-Wicks, State Health Commander, and the Deputy State Controller, Donna Adams. Look, as I've said many times in this room, the safety of Tasmanians is of the utmost importance. It's been our singular goal since day one to ensure that we can keep people safe and healthy. Unfortunately, the COVID positive man who absconded from hotel quarantine has not been cooperative, leading to inconsistency and non-disclosure of information. Unfortunately, it took 2 days to verify that he was at the Woolies, and with growing concern now that he has had in fact several touch points within the community. We can't continue to wait another 2 days to find out more about what's been going on. Additionally, a further primary contact of the man in the northern suburbs breached home quarantine last night. He has been apprehended and fined, and he's now been placed into a government hotel. Now, prior to reaching our vaccination goals and in readiness to open our borders before Christmas, we simply cannot afford for an outbreak to occur and to put the health and safety of Tasmanians, and especially the health and safety of vulnerable Tasmanians, at risk whilst we get our vaccination rates up. We're at a crucial stage of the vaccination rollout, and with a plan to be open before Christmas and to hit those vaccination rates, we need to ensure that we can continue with that. Therefore, on public health advice, as a result of the circumstances that we now face, there will be a 3-day snap lockdown in southern Tasmania. This will commence at 6 p.m. tonight and be in place for 3 days. It'll end at 6 p.m. on Monday the 18th, subject to public health advice at that time, but obviously we will keep you informed over coming days. The lockdown in southern Tasmania will include the local government areas of the Brighton Council, the Central Highlands Council, the Clarence City Council, Derwent Valley Council, Glamorgan Spring Bay Council, the Glenorchy City Council, Hobart City Council, Yuin Valley, Kingborough, Sorell, Southern Midlands, and the Tasman Council area. Other areas of the state at this stage are not in lockdown. Regardless, I would say please remain vigilant and get tested if you have any cold or flu symptoms, no matter how mild. Also, if you're outside the lockdown region, then please do not travel into the areas that are locked down unless for essential or emergency reasons. From 6 p.m. tonight for the next 3 days, there are only 5 reasons to leave your home. Shopping for essential supplies such as food, beverages, fuel, medicine and health goods within 5 kilometres of your home or closest store. To go out to undertake personal exercise outdoors alone or with members of your household or one other person for safety reasons, once per day for a total of 2 hours only and within a radius of 5 kilometres from your home. You can go out to attend medical or healthcare appointments, including to be tested or vaccinated for COVID. You can go to work if you're a permitted worker in the businesses that will remain open over the course of the 3 days, or you can go to school on Monday if the child of a permitted worker or if the child cannot be supported to learn from home. But otherwise, you'll stay home from school on Monday. Other permitted reasons will be allowed, including, and these are matters that we have learnt from past experience, seeking veterinary services for animals, attending childcare, or providing support or care to a personal custody or parenting arrangements. To understand what the snap lockdown means for you, your family or your business, please visit www.coronavirus.tas.gov.au. In terms of gatherings, and I'd encourage people to go to the website to get this information. Indoor and outdoor gatherings are not allowed. There are no more than 10 guests at a funeral, and importantly, no weddings unless for compassionate reasons over the next 3 days, and then only 5 people would be allowed. In terms of visitors to homes, there are no visitors to homes unless they are supporting a vulnerable person, visiting as part of a significant relationship, or visiting as part of a visitor bubble with someone who lives alone who's not in a significant relationship for support purposes. Regarding business restrictions, there are businesses permitted to open with a COVID safety plan, businesses that can open with restrictions and businesses that will be closed. And again, the information is on the website, but I'll provide some examples. Cafes, restaurants and hotels can open for takeaway only. However, places such as day spas, beauty parlours, gyms and hairdressers will need to close over the next 3 days. Supermarkets will be open. However, non-permitted retail businesses such as clothing or homeware stores can provide contactless collection and delivery of urgent household supplies only. Construction, both civil, residential and commercial, will be shut for 3 days apart from for emergency needs or repairs. Hardware stores such as Bunnings will be shut apart from allowing tradespeople or those who have an essential or emergency need. Face masks must be worn apart from in your own home and will be required indoors and outdoors for the next 3 days. Visits to aged care and hospitals are restricted, including the number of visitors and visit frequency and length, and again, information is on the website and Catherine Morgan-Wicks might provide more information there. Regarding travel to Tasmania, Tasmanians who are currently in New South Wales, the ACT and Victoria, noting the challenges that they have and the fact that people would need to quarantine if they arrive here, will not be permitted to return to southern Tasmania during the lockdown period. Returning Tasmanians and other travellers from low-risk locations such as WA, South Australia, Queensland and the Northern Territory who have travel booked to return to Tasmania in the next 3 days, you can return home, but you must enter lockdown.